everybody should have a finger and a nail. Great. All right, so we'll just start with the trepanation first. So if someone comes in with their subungual hematoma, you're going to describe it as, does it involve 1/3, 2/3, 50%, kind of 25%? Describe how much of the nails involved when you document, okay? And with the trepanation, you really want to try to do it within the first 2 days, because otherwise the blood starts to clot and you won't get as much return. It won't be as beneficial. But you can go ahead, just for sake of video and stuff. I know you've probably all done this. But you're just going to, yep. And so you're just going to go down until you feel some pressure. And then you're going to, press and hope to get some return.
Okay. Am I doing it wrong or
Let me
does that
see.
work?
Oh, is yours not working?
Press down and hold. Okay, that might not be working here. Use mine.
Well, no, I was going to use the back camera so I can see one there.
Yeah, a masher.
Okay. Alright, that's okay. Just fine.
Did it? It did work?
That's perfect.
Okay.
Yep.
Yep. Okay, so that's trepanation. You can even do it with a tuft fracture. It's not contraindicated.
Can you do it again real quick just so they can see on that?
No, it's not working.
Batteries are probably.
Is that
It's
working?
not working. Maybe it's me.
There, just hold, hold it.
Just hold it on
Longer. Get it going before you go hit the nail. There you
There you go. Stuck in.
go. Good. Okay.
Alright.
And you don't need antibiotics. I would probably x-ray every one of those if they have a subungual hematoma from some type of crush injury. There could be a fracture underneath. Would it change management? Not really. Those tough fractures can heal pretty well, but you might want to splint them rather than not split them.
Mm-hmm.
Very good. Okay, so that's that. Now we're going to do a paronychia, kind of. So there should be a 18 gauge needle. You might want to come a little closer. Just get right on him. There you go.
Okay.
So let's just say your infection is, I think some of them have redness. Like, yeah, some of the fingers are more red. Yeah, see this one has all that fair, oh, let's take that now. All the redness around there. So you're gonna kind of feel which area is most fluctuant, and you're gonna really just go right for that area that's most fluctuant. And yeah, so most of the time it's more the paronychium rather than the eponychium. So usually more on the sides.
Well, I always like scrape the edge of the nail so then I don't, or should I not do that to kind of get the pus out?
No.
No, you go straight into it on the
Yep,
side?
just like
Okay.
that. And I often like kind of go more of a, kind of use this as a base and kind of just go right in there pretty deep, kind of thing like that.
Mm-hmm.
And then fresh, do your pressure kind of thing. So then, I mean, you could probably do that because with the scalpel, if you want to take your
So,
scalpel.
yeah.
So this would be the puncture is great for those little kids when they're not looking. Just take their hand, and kind of real quick when it takes them, when they're not expecting it. For the adults, you're probably going to do the digital block. Exactly. So yeah, so you just go ahead and punch. Yep, just like that. So, and then you're going to press. Perfect. So that's it with that. As long as you're not right on, down low on that cuticle, kind of that, kind of where the nail bed forms. You just don't want to be down there and disrupt that and cause more harm, kind of thing. Good. And then your antibiotics. All right. Now we'll move on to. It was this package.
Oh,
Hey, Dr. Ritchie, it's Kelsey. I have a question.
Yeah, hi Kelsey.
Am I terrible? I never use digital blocks for adults. I usually just use that painting spray, poke them, they tolerate it fine.
Yeah, if you're just doing an 18 gauge, I wouldn't use any type of block. It's more if you're using the scalpel. But the Paynees is great. I actually brought the Paynees. I forgot to bring that out. Let me grab that. I think it's in here.
Jamie Cross.
guys.
Yeah, we love the painties. So no, I think that's great. So the painties is perfect for just like something simple. But if they've been a lot of pain for 3 days and you're going to use a scalpel, I mean you could go either way, but they might prefer to have it numb for a couple hours too. So yeah, so your painties are just going to spray, right there. And that works really well. Thank you for bringing that up.
And then sometimes if they're just simple, like tiny little Paronychias, I just use some Bactrbane. I don't actually put them on unless they're like super cellulitic.
Yeah, I think that's what like Up to Date says too. I feel like most of the time ours get to us and they're kind of bad. But you can always start with that, and you can always do a delayed prescription approach. So they don't have to come back. So then just mark it for a day or two later. Yeah, good point.
Thanks.
Good. Okay, so now we'll do let's do a nail bed injury. Okay, so you've done your block. Now maybe your laceration is down here, or maybe it's just right up here. So you're going to use your Freer elevator and kind of shimmy underneath there. Again, they're numb. So on this one, your cut is just right there. So I don't think we need to take the whole nail off. So then you want to hold the thumb there. So after you've done your Freer elevator and you kind of loosened it up a little bit, you can, hold it with this, and it might be a 2-person technique too, but a lot of times I have to hold it off the skin a little bit, and then you're going to take your scissors and then you're going to come and just cut that one area. Now this part's still in there. Now you can see a little bit better of how bad that is, and then put in your chromic. Does that make sense?
Mm-hmm. And then you wouldn't need to stent anything because it's already stented, so you just do a simple dressing like
Simple
Vaseline or
dressing,
Xeroform or
right,
something.
exactly.
Okay.
Now, let's say you're going to remove the whole nail. The injury is deeper. So now you've done your Freer elevator. There we go. And it's really more on this side down here where it's really, caught. So you're going to make sure you get all that. Then you're kind of going to lift it up, shimmy. Now you have to kind of pull off to the side because these nails are from Dollar General. They're not really, they're just press-on nails. So then there's these long fangs that, are down in that cuticle. So you have to lift and rotate out, get that fang out, and then kind of get this fang out. Now that you have both of those out, you grab the middle and and then you pull the whole thing off. Okay, so now you have you can see and explore and figure out what you need to do. And even at that point, if you're like, oh, this is a lot more complex or deeper than I thought, you've already started the procedure for the plastic surgeons or the hand surgeons, and you can still send them like that with the nail, okay? So if your nail is, can I have your nail? So now we're going to do our chromic. Okay, so we've prepared this now, so we're just going to pretend with our needle drivers here. This is a 3/0. This is what you would not want to use. So you really want to use that 5/0 or 6/0. And you're just going to repair it like you normally would. Just going to go in and, do your normal repair, okay? And you probably wouldn't use as many as you would do somewhere like on the side of the finger, because it could be irritating. You're just kind of wanting to reapproximate it. So 2, 3 kind of at most. So you finish that. Now you have this nail that you've removed. The nail's still intact. It looks great. You're going to clean it and you're going to scrub it. You're going to scrub that bottom because it has all this tissue that's been adhered to the nail bed. So you're going to soak it, betadine, ivory soap, clean it, get it wet. You're going to take some 2x2s and really scrub that. So when you're done, that nail is polished and perfect, okay? Again, it's going to have these crazy looking long fang-like things. So you're just going to now take your nail And you're gonna, this is all good. You might wanna put a little bacitracin ointment on there. Then you're gonna put your nail and you're gonna shimmy it back in. You're gonna put like the edges in first and then the center, and you're gonna make sure you're underneath the eponychium. And all right, it's good, right? It's all gonna fit. You kind of reassure them. Forgot, before you wanna do that, you wanna put holes in your nail on each side. This is where you would take the 3-0 chromic or something that has a pretty strong, good needle on it, okay? Then you're going to put a hole in each side, kind of right in the middle, right here. I can see. That's a little far in, but okay, so you got a hole in that side. Then I'm gonna put a hole on this side. So I get my holes.
Kind of like pre-drilling on the wall.
Pre-drilling, yeah. Okay, that one didn't work either, but okay, so now I got my holes in. Now I put my nail in. Then I go to the side here and I go up through the hole that I just created.
Hard to see where.
It's hard to see. It's
You,
usually a little easier than this.
you could also use an
You can
18
see.
gauge needle.
Oh yeah, you could also
And make
puncture
it
it.
bigger.
That's a good
I've seen
idea.
that done.
So then you're gonna take that through and you're gonna just normally just tie and tag, and I do that on both sides. So now it's it's secure. You've tagged it. This is just a tag on both sides. And then that chromic's gonna dissolve in 2 weeks anyway. So yeah, we'll go ahead and just tie.
And now, the care after that for the patient is normal, just, no soaking, normal soap and water.
Right.
And then
Right.
like, they
And
never
you
really
just
have to
tie.
follow up or anything, right? It just will, the new nail will push out.
The new nail is
that
gonna push
stent.
out, exactly.
Okay.
So now you've tagged it on both sides. So now they have the couple underneath there and there. Now often these are a little bit more complex than just a nail injury. It might have extended all the way over here. You've seen all those. So now you might have 3 or 4 stitches over there, 2 underneath there. You've explored underneath the nail. You've explored the whole nail bed. I'm good for this person to go home. Now if they have a tough fracture, you would do more of a finger splint. If they just have this laceration, then you're probably going to do more of a cage to protect it. Because it's a pretty complicated finger injury, you can consider your calf flex and stuff, especially if they're diabetic or older, but it's not necessary, especially if you do a lot of pressure irrigation. So you're going to irrigate, irrigate, irrigate. I think that's it. Did we cover everything on the, okay?
So,
Now we're going to do a toenail removal with Kim. Not really the whole.
I have had several cut out, and I do like to cut them out.